now.
Awesome. That's perfect. Yeah, we have a hard cutoff like right at 3 for
Okay,
another meeting, so I want
we
to
should,
make
we
sure
should
that
be able to
we're
get through it pretty easily by then. And
okay.
since it's Friday, I don't want to be the one standing between you and going on to your weekend. So, okay, let's go ahead. I'm recording it now, so let's go ahead and get started. Today, performance monitoring is all the tools that we use to see how the plans are executing in there. So just kind of as a quick review, operational planning we've been all through, and several of you have completed the homework, and the certificates will be on the way coming out here. Um, but once you have the plan in place, then you're actually executing the plan. And as you're executing the plan, the real time planning tools, the automated email notifications and such, are allowing you to collect information in the background about how the plans are performing. And then you're going to be able to look at it at several different levels. First thing we'll talk about is the macro level of the dashboard, which is up at the group level in the pyramid. Then we're going to talk about the micro level, which is down at the objective and activity level in the pyramid. So it's the nitty gritty things that are going on that could potentially affect the macro level. Then we're going to talk about reports, and we're going to talk about four of the reports in the system because the other reports are related to the three-dimensional planning, which we haven't got through yet. And then we're going to talk about VMSG Public, and we'll actually build a VMSG Public web page out of the tobacco plan on your account here.
Perfect.
And the reason that the performance monitoring makes critical sense here is that when we're doing the execution and we're collecting the information, we need to be able to go and check. And the check is a pretty simple thing. If you're collecting the information in the background, it's real easy, and I'll show you that we're going to check the plan against the actual. So you remember we had a plan of a 25% reduction of smoking at Wayne High School. Well, the plan is 25, and in that case, our actual happened to be 25 at that point in time. So it makes it real easy to determine if you need to make any adjustments, and then going back through the cycle here.
Excellent.
And then just real quickly here, we'll kind of go review the pyramid, and we're going to use the same example, the tobacco cessation. But when we're going to talk about the macro level, we're going to be up here at the group level. When we get down to the micro level, we're going to talk about objectives and activities. The reports will cover everything from the groups all the way down. And then the VMSG Public, we can also build web pages from anything from the groups all the way down here. So let's talk about the dashboard first. Let me take you back live here. I'm going to be using the USA Public Health just because I know all the data that's in there. I'm going to go to my groups tab. So as I said, the dashboard itself is based on the group you have selected. So I can actually have a dashboard for the entire department. I can have a dashboard just for my strategic plan. Now, just kind of an FYI, the um, dashboard includes the group you have selected and its first level subgroups. So for instance, at the department, we have several level 2 groups reporting to the department here. So they would all show up on the dashboard for the department. If I go down here to our community health division, you'll see it's a level 2 group, and then it has tobacco and WIC underneath it as level 3. So I'm going to do the dashboard for community health, and that dashboard then will contain the data for tobacco and WIC as well. Now, I think we talked about this earlier, but when you log into the system, everybody is assigned to a default group. So I'm going to be the community health director. So when I logged in, it took me right to community health. The reason for that is if I'm the community health director, I may or may not be, putting plans in the system or updating plans, but I do want to know how is community health performing. So the only thing I would have to do is just go to the traffic light up here in the top right corner, these quick links, and click on the traffic light, and it takes it about 10, 12 seconds to generate the dashboard screen here. And this is what it looks like. First thing I like to talk about is this home page button up here. As I mentioned, when I log in, it takes me to my default group. If the only thing that I was going to be really looking at is the dashboard, I can make this my login homepage. I click on here, a little dialog comes up and says, you want to make this your login homepage? I'll say yes. The next time I log in, instead of going to the main menu, it's going to go directly to this screen specifically for my default group or community health. So the only thing I have to do to get to my dashboard is log in. So that's all there is to it. So it's really kind of a nice tool to have for those folks who are more interested in the dashboard than anything.
And the only thing we have to do here in order for this to generate is just be selected on that group.
Yep, you got to select the group, and obviously you got to have the plans and everything in there because this is looking at the different levels of the pyramid in the plan. So
Excellent. Thank you.
right now I've selected the activity level. So What it's looking at up here in the top left corner is the traffic lights. So in this case, we're saying in community health and WIC and tobacco, we have a total of 0 red, 3 yellow, 4 green, and 7 gold traffic lights. Now I can also move up and look at the objectives or the goals. I'll get the same thing, but it's going to be the traffic lights for the objectives or goals. Then the other thing we have here is the schedule gauge. It's kind of an interesting number here because what it really is an aggregation of the beginning date, ending date, and percent complete for the activities that we're looking at. And let me tell you how that's calculated. So let's say I have all of these 14 activities are beginning date of January 1st, 2025, ending date of December 31st, 2025, and let's assume today is January or July 1st, 2025. So we're exactly halfway through the year, 50% of the way through the year. Let's say one of those activities is the percent complete is only at 40%. So if we're only 40%, that means we're 10% behind where we should be based on the time of the year here. 10% of 365 days would be about 36, 37 days. So it's a minus 37. And let's say another one of those activities is at 60% complete. So it's 36, 37 days ahead of schedule. The two of those will balance out to 0. So if you take that calculation across all the activities and add them together, in this case, we're saying we're just a little bit behind schedule here, 15 days behind schedule across 14 activities, which really is not bad at all. Typically, it could be just one activity that's deadlocked because somebody left the organization, whatever it happened to be in there. So that's telling us kind of where we are overall. Now, when you get on schedule, it'll turn green, and you get 60 days behind schedule, it'll turn red. So the idea is by looking at the colors and the numbers, you get a quick snapshot of performance of your area of responsibility. Now, down here at the bottom, we have the ability to drill down to a couple different things. The first one is our people. So these are the people we assigned as activity leaders. Now, if I was up at the objective level here, this would say objective leaders. So remember, we can do objective leads as well. So I'm looking at Diane Cox. I go to the next column here. It says, what is the last time that Diane updated her information? So it's saying 326. The reason it's green is because it's less than 30 days ago. Then we have Fred and William at 30 to 60 days ago. And we have Tom at over 60 days ago. So the red is over 60. Typically, you don't worry too much about the yellow as long as it's not too far overdue here. And, it could be that Fred and William happens to really be my son, but we were on vacation maybe together and during the time that the email came out. So we didn't really have the chance to update our activities or something along that line. When you get to red, though, that means that, it's been 60 days. So it's probably time to have a chat with Tom and just say, hey, do you need a little training on doing the quick updates and that sort of stuff and get him up to speed? The FTE column here again is how many FTEs did we assign to each person? So remember, the FTE is a 0 to 1. So ideally, you're never over a 1.0 FTE. When you get up to something like a 1.55, again, a lot of demo data. If you're up to a 1.55, that means that Diane is doing the job of 1.5 people, which overloads people and they tend to leave the organization. So you want to keep everything. It's just kind of a metric to look at. If you keep everybody below a 1.0, you're in great shape. Lagging, the same calculation we talked about up here is calculated by activity down here. So we're saying that Diane has 2 activities that are lagging behind schedule. And in this case, at least one of them is 60 days, hence the red here. Then overall, Diane's activities are 7 days ahead of schedule. So across all of the 21, 25, 27 activities that Diane's been assigned, she's 7 days ahead of schedule, which is great. Overdue, again, indicates that the ending date of the activity is before today and it's not marked as 100% complete. So we have 7 of those. And again, at least one of them is 60 days behind schedule. And then a number of red, yellow, green, and gold. So the idea here is to be able to have a snapshot of the performance of your people against the plans that you created. And this, by the way, the top left corner up here is specific to community health, tobacco, and WIC. The bottom down here is global across the department. You can't go in and say, I just want to see the activities that Diane is assigned to in community health division, because that way it's not a good picture, especially when you get to FTEs. I mean, she could be having, a 1.5 FTE elsewhere and just a 0.1 FTE within community health. So it's the bottom of the screen is kind of global across the department here. So that's view number 1. View number 2 here is my groups. So in this case, because we've selected community health, you're going to see community health, tobacco, and WIC down this first column. And then the data points are exactly the same over here. And then our third view is priorities. Priorities, when we get your strategic plan in there, will be the strategic initiatives, what we call services or initiatives from your strategic plan down here. These are the ones for the USA Public Health. So we've got the 5 strategic initiatives, and then these are going to be mapped against everything else in the system. And the way we do that is through the 3-dimensional planning, which we will get into in the next training is 3-dimensional planning. Basically, it's the ability to link all that stuff together. So you're going to go in and say, what are we doing across the whole department related to partnerships? And you're going to be able to map it to all the other plans related to partnerships. So we'll get into that in detail. I'll go back to my leaders here. Top right corner, my priorities. Is all this is a bookmark for things you just want to keep front and center up here. So in this particular case, we're saying we have an objective, and these are objectives, so they're the targets in here. I have an objective by September 30th, we'll educate 2,500 parents and caregivers, whatever, in there. The way I set these on is, again, they're objectives. So if I go to this particular objective and I want to take it off there, this is the green flag. If I take that off there, it's gone. I put it back on there. If it's green, it's there. So let's go ahead and add another one on it. So I'm going to go ahead and add this top one to it as well. So you notice the flag is gray. I'll click on it. It turns green. And now to get back to my dashboard screen, I've got a couple of choices here. I can either go back to the traffic light or I can just use the back arrow. If I use the back arrow, it's going to do exactly the same thing. Now, each time you go back, it does take about 10 or 12 seconds to calculate. The reason being that it's a multi-user system. So even though I didn't make any changes where I was, there's potentially other people in the system making changes that would have to be reflected in the dashboard. So we just go through and recalculate it each time. The other thing I want to show you is that everything on the screen, as you can see by the little click finger here, is clickable. So if I want to see these 3 yellow activities, I can click on that. It's going to take me right to a screen with those 3 yellow activities. So I can take a look at these and say, oh, maybe I can talk to Diane to find out why this is still yellow, or, maybe I forgot to update it, so I can go in and do the updates, that sort of thing. So just the ability to get to anything that's on that screen, any of those numbers you can click on and get right to that data, so you don't have to go searching for it at all. And again, click the back arrow to get back to our dashboard screen. So that is what we call macro level performance monitoring. Again, the big picture here. So you notice now we have both of these up here. Now, I don't know if you guys have tried this yet or not, but if you go into your phone and go into the web browser on your phone and go to the same link you would to log in on your dashboard, login.vmsgdashboard.com, and then use exactly the same login credentials, so your user ID or email address and whatever password you've set up in there, it'll bring up VMSG Mobile because it knows it's a phone. And VMSG Mobile, this is the same screen you just saw broken down into 3 phone screens. So the top left corner, bottom, top right corner, same exact functionality. Everything is clickable on here. I can turn my priorities on and off of my phone. I can look at the 3 different levels down here, the leaders, groups, and priorities. I've got everything is clickable. I can look at these 5 particular activities that are in the yellow status in here if I want to. So again, it's just kind of a convenience feature for those folks who aren't necessarily sitting on the desk all the time. So that's macro level. Any questions on macro level?
I don't think so. This is great. Thank you so much.
Okay, let's talk about micro level. Again, down at the objective and activity level here. So I'm going to go back down to here. I'm going to go to my groups tab. I'm going to select tobacco, and we're going to use the same plan we've been using here. So tobacco cessation, reduce smoking in high schools, and then reduce smoking at my good old alma mater, Wayne High School. The micro level is really the specific timeline activity for this selected objective or the activity, same thing. And it's this button right here. So I click on that button. It shows me from day 1 when we started the program back in August of 23, we're at 0% reduction, and we slowly ramped up and got to our 25%. So that's basically what you're going to use is just looking at this chart. Now, you can make some tweaks to that chart. A couple of them up here. So the first thing I can do is set a timeline. So let's say I just wanted to look at, maybe this has been going on for several years, and I just wanted to look at each year independently. So I can go up here and I'm going to say 1/1/23, and then I'm going to say 12/31/23. So I'm just looking at the 23 dates. And when I do that, you'll notice everything past December of 23 disappears. So again, the ability to tweak the date range the way you want it. Now, when I do that, I got a couple of choices here. You'll see on this drop down. Raw says, show me every data point that was ever saved in this particular objective. The days says, just show me one data point per day. So maybe I'd done multiple updates in a day for some reason, one per day, one per week, one per month, one per quarter, one per year. And if you had multiple years, let's say you had 5 years in there, you might just want to see one data point per year in here. In this case, I'm going to say, let's look at one per month. Now, which ones? Let's say I'm updating it every week. So I've got 4 data points per month, roughly. Do I want to see the last value of the month? Now, if the chart is climbing like this, probably you want to see the last value because you're continually moving ahead. If the chart was that chart, remember we had the activity that said do 9 training sessions each month. So if I'm down here going 9, 8, 10, 9, 8, 7, 9, 8, 10, whatever, I might want to see the average of that. So in this case, I could select average, and it's going to show me the average data point in here as opposed to the last data point. So that's what these buttons are all about up here. The vertical type you don't need to worry about because that's set. Is a default when you are setting your objective. If you recall the title in the bottom left corner that says % complete, you can click on that and you can select either value or a %. In this case, we've selected a %, so it automatically carries up to here. But the other thing we have up here is the ability to set the scale. So the default auto scale is 110% of the highest value. So you see the highest value is 20 and the scale goes up to 22. So that's all the auto is. My other choice is 100% scale. So now the reason that this is, I mean, some people want to look at, the entire scale 100%. But for me, if I'm showing somebody that, hey, we're making progress, this doesn't look like much progress. It looks almost flat because of the scale. So if I take it back to the auto scale here, to me, it just looks better. So that's kind of why the auto scale is in there. Now, you guys as org admins or manager level users have the ability to save the defaults. So let's say the program is over with and we had a few data points in 24, but the program is over with in 23. So the only thing I want to show is the 23 data points. So I'm going to go ahead and set this just exactly like we have it up here. 1 data point per month, the last value of the month during the year of 2023. I'm going to set that. I'm going to say auto scale, and I'm going to use this save defaults button down here. What that does is save exactly these values that you saved up there. So the next person that goes in there is going to see the chart exactly the way you saved it. Now, anybody who is, again, a manager or an org admin can redo the settings and save it. If you're just a normal user, the normal system user, you can save or you can change the values while you're in there looking at it, but you cannot save it. So what's going to happen is you can change it. I want to look at 22, 23, and 24 together. I'll set all that up. I'll look at it and say, okay, I'm happy with what I see in there. But when you go out and go back in, it's going to come back to the values that we have set here. So normal users can't save it. They can look at it, they can change it, but they can't save it. So that is the macro or micro level performance monitoring, again, at the objective and the activity level here. Now, the question always comes up is, where does that data come from? Well, let's look at that. The history file. So let's go back here to my objective. So this is the button I was using to get to the chart. The data points are stored in the history file. Every time I hit this save button, it's creating a data record in here. So I'm going to click on the hourglass, and it's going to show me the history records for the entire program here. So you notice down here at the bottom, it's reverse chronological order here. So 8/15 of 23, Fred Erickson added a green objective, no notes, and it was at 0%. And then as I go up the chart, you can see all the different percentage. This status is what's actually being, the status is what's actually being mapped on there. So those are the data points that are in there. Now, most people don't do anything with this other than just look at it, but you can do a couple things. So for instance, if you were showing somebody this particular objective and you're showing them how to save it, how to update it, that sort of thing, and you ended up with additional data points, because they're reverse chronological, they're going to be up here at the top. So you can delete data points in there. So in this case, or maybe you had too many for a month or duplicates or whatever it happens to be. I can go up and click on the date, and then you notice the date shows up down here in the bottom, and then I can hit the red X button and it'll delete that record. So if you want to delete records, you can do that. The other thing you can do is change dates on records. Now, typically the only time that ever comes up is if, let's say and you guys are in the process of implementing this system, there's probably a lot of stuff you're going to be implementing that you've been working on long before this. So if you had like a spreadsheet or something and you want to go in and input data points, the way you do that real simply is go to the objective, and let's say you're going to change this value and maybe the actual objective or the notes or whatever you want to in there. You're going to change it to what it was back in, let's say, 8/15 of 22. So I'm going to save it to whatever it was, hit the save button. Once I do that, it's going to create that new history record. It'll be at the very top. I'm going to go up here, click on it. I'm going to change this date to, let's say, 6/30 of 2022. So now it's going to move down to the bottom, and I'll have a new leftmost data point in there. Again, if you're entering historical data, that's kind of the only time that gets used, unless you have consistent data that you want to change the dates on for the appearance of the chart or something like that. So it's available to be able to do that, but it's not something you do very often here. So that is micro level performance monitoring. Any questions?
Questions?
I have one.
Yes.
So like, let's say, I don't know, I want to like adjust. I'm trying to think of how to word this well. Like if I go into the history of a document and or the history of the save files, and like I want to change the date on something because it's not actually reflective of the day it was saved.
Right.
Can I do that?
Yeah. You just click on the date. You go down here and put in the new date that you want it to be, hit the save button.
Okay, perfect.
Yeah. So if I wanted this to be 6/30 of 22, I could change this to 6/30 of 22. When I save it, it's going to move down here because it's going to change the sort order.
Cool. And is that something that anyone can do, or is that just admins?
Admin only. Well,
okay.
I'm sorry, admins and managers can do that.
Okay, great.
Normal users don't even see this down here in the bottom left.
Okay.
Which we try to do that for a reason. We don't want everybody messing around with it. Okay, so that is micro level. Let's talk about some reports. Okay, there's a bunch of reports in the system. Today we're going to talk about the 4 most used reports. The ones we're not going to talk about, I'm going to go back here to my groups and I'm going to select the tobacco group. This is my reports menu, the blue one up here at the top right. So we got the dashboard, reports, main menu, help and information, and log out. I'm going to go to my reports menu. So the one that you'll use, if you can't think of which report to use the operational plan report. It's the one that you use 90+% of the time. The ones we're not going to talk about today are the category tag report, the categorization report, and the categories report. Those are part of the 3-dimensional planning. 3-dimensional planning is all about categorizing plan elements against a set of standards. That's what those are. Today, we are going to go into the operational plan report. The second most used report will be the team lead report. And what that is show me everything that Fred Erickson as a team member is assigned to, whether it's at the activity level or the objective level. Comes in real handy if you're doing reviews with people, or if you're somebody's leaving the organization, you want to change them out. I'll show you how to do all that. So it's the second most used. The next one we're going to look at is the partners report. And basically this is merely a list of the external partners you put in the system. It's a list of the partners with their email addresses, phone numbers, contacts, all that kind of stuff in there. And then the partner activities report. This is kind of like the team lead report, except for external partners. So show me all of the activities that Fred Erickson at VMSG Dashboard is an external partner to. And again, you're going to have partner reviews. You're going to have a report that you can use. You change partners. You can go in and change the partners in there. So let's start out with the operational plan report. So this is the operational plan report for the Tobacco 2025 program. Okay, so at the very top, we have, if you have vision, mission, and values attached to the particular group, then it's going to show up here. And then we get down to the report itself. So we start out at the group level. Oh, one thing I do want to talk about here, let me go through this and I'll go back and clarify that. So I have the group, I have the initiative, tobacco cessation. My goal is to reduce smoking in high schools. Any notes show up in blue and in the row right below where they belong. So this is the notes for that goal because it's right underneath there. Here's the notes for that objective. They show up right underneath the objective. So they're always right underneath the plan element. This is the data source we've talked about. that just going to view the description of the data source. As I get down in here into the activity level, I have exactly the same stuff, but it basically shows every piece of every information in those reports. Now, the one thing that I did want to mention is you'll see at the bottom here, we have initiative 2 and 3, secondhand smoke and tobacco initiation prevention. That's because I selected the group when I did the report. So I'm going to go back here and I got the group tobacco 2025. Down at the bottom, we have what we call a cookie crumb. And basically, if I roll my mouse over, it says, where are we? It's kind of handy in a couple different things. So you're working on a plan in the system or updating something. Somebody calls you on the phone. They keep you on the phone for 15 minutes. You go back and look at the screen and say, where in the heck am I? So you can always go roll your mouse over here. It says, okay, I'm in the tobacco programs for 2025. And then here you'll have the initiative, goal, objective, and activity numbers. So you notice we don't have anything in there. If there's nothing in this service initiative box here, then the report will be for the entire group, which will include tobacco cessation, secondhand smoke, and tobacco initiation prevention, just like I showed you. If I'm at this screen, or at least this number appears in here and it shows me tobacco cessation, the report will only include tobacco cessation and will not include secondhand smoke and tobacco initiation prevention. The reason is that some plans, like your strategic plan, is a complete group, a complete independent group. The plans that you guys were developing for your homework and stuff were actually starting at the service initiative level. So some plans start at that level, so you want to be able to generate the report just for that plan. Now, there is kind of a little gotcha here. If I go back to my groups tab here, you'd think, okay, I'm going to generate the report for the group. Well, not really true, because you still have this one in here. So to get rid of that one, I just click on the group here and it goes away. Now I'm back to generating the report for the entire group. So I'm going to go to here and just generate the report for tobacco cessation. Again, operational plan report. Okay, so here's our report again. Yeah, and if I'm generating the report for just a single service or initiative, you'll notice that the vision, mission, values doesn't show up. So if you don't want it up there, just do a single report that way. Okay, so we have all of the data in here, all the traffic lights, all the people, all the status, everything you want to know. A couple things you can do. This calendar button, if you open it up, just has a beginning and ending date. And what you're looking at is just show me all of the activities that were meant to be completed in, let's say, March. So I put in March 1 through March 31st. The reason for that is, the March is coming up on an end. What am I supposed to have got completed in March? So what it's going to do is just filter out all the activities that don't end in March. The other thing I might want to do is say, what am I supposed to be doing in April? April 1 through April, whatever, April 30th, I guess. You're going to go in there. It's going to show you all the activities that you have coming up in April in there. So that's all that's about, is being able to filter it by date. And it's always the end date of the activity that you're filtering on. As you recall, you can attach documents anywhere in the system. So if I want to see which documents are attached where, I can just click that little checkbox. And it takes it a second to generate the list here, but everything in green are documents. So it says we have one document attached, and here's the file name for the document. It's, again, right underneath the initiative. So the document is attached to the tobacco cessation initiative. Down here, I have a document that's attached to the goal. Down here, I have two documents that are attached to the objective. You barely see it, but there's a semicolon in between there. So you can have as many documents as you want in there. They'll line wrap, they'll do everything for you. So if you want to have a bunch of documents attached, you can do it. Same thing down here at the activity level. We have one document attached at the activity level. And where this is really, really handy is if you're using the accreditation plan and you generate the report for the accreditation plan, typically you're going to have a whole bunch of documents attached at the objective level, because that's the measures in there where the documents typically get attached. So I can show every document attached to every measure. And it gives you a good idea that, whoops, we don't have any documents attached to 9.1.6 or whatever it happens to be in there. So just a nice tool to be able to look at it that way. The other thing that will happen over time is you could have lots and lots of notes in there. So if you're updating the data, and every time you update it, a lot of people like to put in a time and date stamp note in there that says, Fred Erickson changed the value from 20 to 25% or whatever it happens to be in there, or change the traffic light to yellow. And over time, you can end up with literally pages and pages of notes. Well, if I have the report out here and it's got pages of notes, it's really hard to follow, all the different levels of the report. So just by hitting this button here, I can hide all of the notes in there temporarily. So in this case, you'll see all the blue has disappeared. So what it does just cleans up the plan as you're generating the report. Now I'm going to go all the way over to the far right over here. I got the level of report I want to look at. So if I wanted to look at just the services here, and we got tobacco cessation, that's all that's in there. Or I can go down to goals, which would be services and goals down here. So you see we have the 3 goals. So it's just showing me what level of the pyramid do I want to show. If I go back down to the activity level here, it's going to show me everything. And I skipped over the status because the status is related to what level you have selected, goal, objective, or activities. And what I'm saying is I want to see just the yellow or red or whatever. In this case, I want to see just the yellow activities. So I'm going to go down here and select yellow, and it's going to filter everything out except the one yellow activity. And again, where that comes in handy is if you got 100 activities in there, and I just want to see the ones that potentially have an issue going on, yellow or red or whatever, I can do that. Now I can also do the same thing by switching to objectives, and if I do that, it's going to show me just the yellow objective. In this case, just this objective is the yellow objective right here. So I can do goals, objectives, or activities and use the status for that. So let's go back to our activity.
Can I select more than one status at a time? Like if I wanted the red and yellow?
No, unfortunately, you can only do one at a time.
Okay.
Yeah, what you can do is you can do the yellows, for instance, and then generate a report, put it into Word, then generate a report for reds, and then just combine them together in Word if you needed to do that.
Okay, great.
Okay, now, how do I get the report out of the system? First thing I'm going to do is click on this little button down here in the bottom right. Now you'll notice that the default name is VMSG report.htm, which is HTML, which is a web page. We did this for a reason because a lot of times you want to be able to share that information with your colleagues or with your community or whatever. So it automatically generates the report as a web page. So if I click on that, it's going to ask me where I want to save it. So you do have to save it first. I'm just going to go ahead and save it to my desktop here for now. Save that, and it's going to pop up over here to open up. And there it is. Okay, so I'm going to open it up. It'll open up in a new browser tab. There's my report. Again, right now it's a web page. If I wanted to print this report, I just use the browser control. So I go up here and I hit print, and I can select Microsoft Print to PDF, or I can do any printer that I have attached to the system, anything like that. So I can print it anywhere. I do recommend that if you're going to print it or display it as a web page, that you use landscape mode, so sideways and narrow margins. It just makes it look better. It will adapt to anything you do in there, but sometimes when you get a lot of notes and stuff, it just kind of doesn't look as good. So landscape mode and narrow margins. So I can print it anywhere I want. I talked about putting it into Word. Because HTML formatting is almost identical to Microsoft Word formatting, I can click anywhere on the report. I'll hit Control A, which is select all. I'll hit Control C, which is copy. Then I'm going to pop open a Word document. I'm going to set it to landscape and narrow margins. I'll hit right click and copy or paste, or hit Control V to paste it in there. It's going to look exactly like this report in a Word document. Then again, you could combine if you wanted to, or you can, whatever you want to be able to do, highlight things, delete things, anything you can do in Word. So just the ability to put it into Word is just kind of a nice extra feature, if you will, in there. So that is the operational plan report. Again, you're going to use this most of the time, unless you're looking for specifics about a people or a partner in there. But let's go talk about that. So I'm going to go back to my groups tab. I'm going to select Community Health Division. I'm going to go to my reports menu again. This time I'm going to select Team Lead Report. It's done that to me before. I don't know why it's doing that. I was doing this yesterday. Oh, no wonder. I got a specific person in there. That's why. Okay. I don't know how that happened. Okay. So I'm looking at the Community Health Division. So these are the 3 people who belong to Community Health. When I want to generate a report, I can generate a report for either objectives or activities. And I can select, when I say individual, that means the person I've selected up here, in this case, Andrea Schoen. If I say group, it means all 3 of these people in the Community Health Division. If I say all, that means everybody in the department. So I have one report that shows everybody in the department, how they're attached to either activities or objectives. If I selected objectives over here, That's all I need to do. This doesn't do anything for objectives, because over here, if I'm selecting activities, I can say, I just want to see where Andrea is the team lead, not where she's just a team member. Or I want to say just where Andrea is a team member and not the team lead, or whether she's either a team member or team lead. But that only applies to activities. If I go to objectives, there's only a team lead, so it just will default to team lead. I got two choices down here. When I hit the magnifying glass, that's going to give me an editable screen. And right now it's going to be all of the objectives that Andrea, the individual, is assigned to. So I'm going to click on that, and it's going to show me, there it is. So these are all the objectives Andrea is assigned to. And you'll notice down here, the objective lead is set to Andrea. This is really kind of nice when you got turnover of people or somebody being promoted or whatever it is, and I want to change it. So I can go click on the objective. I hit the drop down here and change it to whoever the new person is and save it. It will actually disappear from this list as you do it. So as you go down the list, it'll disappear because now they're no longer Andrea, it's somebody else that you put in there. So this is just kind of a nice tool to be able to make updates and changes around the people that are assigned here. Let's go back here. Again, I can do the same thing with activities, either the team member or team lead, same thing here. But I can also generate a report. So if I want to see all of the activities that Andrea is the team lead on here, I'll do that and I'll click the report. It'll take it a few seconds to generate the report. But again, the reason I like this report is if you're a manager and you're doing like monthly updates with your people, one-on-ones, I call them, it's nice to have a list of everything that, in this case, Andrea should be doing and the status of everything that she is doing. So you both have a copy of the paper in front of you and you kind of go through it and grab all the information that you need and talk about it here. I think Andrea's got a whole lot of activities, if I recall right. Yeah, there we go. So, okay, so because I selected activities, the activities are in dark black font here. Everything else is in gray. If I were selecting objectives, it would look just like this without the activities, but the objective would be in dark font in here. But all this is all the activities Andrea, you can see, has been assigned to over here as the team lead. I could also, again, just say where Andrea is the team lead or team member. But again, this is the kind of report that you want to be able to have if you're doing like one-on-ones or something. So that's the team lead report. Next thing I want to talk about, I'm going to go back here to community health, open my reports again, partners report. Once you guys have external partners entered in the system, you're going to be able to go in and look at the list of partners. So I'll click on this, and here's my list of partners. Now it's asking me some questions over here. Do I want to see just the information about VMSG dashboard, the selected partner? I'm going to say no. Do I want to print the contacts? So each one of these could have potential people associated with them, contacts. I'm going to go ahead and say, yeah, I want to see the contacts. And do I want details, meaning email addresses, phone numbers, all that kind of stuff? I'll say yes. And then when I hit this, it's just going to give me a list. And in this case, we have Andrea's car seat installation. We got the address. We got the people involved, Andrea and Fred. Got the email address, phone number, fax number, mobile, everything you want to know but we're afraid to ask. And once you get a whole bunch of partners in there, sometimes it's nice to just look at this list and say, oops, Bill's car seat installation went away. They're not with us anymore. So I can go back into my partners list and take them out of there. So that's all that report is a list of existing partners. The other one that is a nice tool to have is the partner activities report. So where are different partners assigned? So remember, we had VMSG dashboard assigned to our activities in the tobacco program. On the left side, you have the partner organization. On the right side, you have the person within that organization. So right now, there's only one person in VMSG dashboard, Fred. If I went up here to Andrea's car seat, you see we have Fred and Andrea's partners in there. So I've got that one to do. Now, I got a couple of choices. On the left side of the screen, and by the way, the magnifying glass, again, is an editable screen, and the report, it'll look just like the ones I showed you before, except with the partners on it. But the left side would be for the organization. So let's say I had 10 different contacts in here, and I just want to see where any contact is attached to a partner or to an activity. I'll use the left side. On the right side, it's going to say just where Fred Erickson is assigned. Now, when you're assigning you do not have to assign a contact within the partner. So it could be you have several of those that are just assigned to VMSG dashboard without being assigned to Fred. So basically, you're saying in this case, I just want to see where Fred is a partner. And again, Fred's leaving the organization, you're bringing somebody else in, whatever it happens to be, it just gives you the ability to look at that. So at this point in time, I can hit the search button. It's going to show me that editable screen that I can go in and take a look at it. It's going to have all the partners that, or all the activities that Fred Erickson is associated with. So here's the three of them. And down here at the bottom is the activity partner, VMSG, Fred Erickson, and all of these should be the same down there. So again, I can change that out real quickly. Just allows me to focus my efforts on exactly what I'm doing. Again, the other thing you can do is generate a report. So if you're having a quarterly update with your partners, I can go in here and generate a report for VMSG Dashboard and Fred. I'm going to have a quarterly meeting with them. I'll generate the report, and it's got all the information. It's like the operational plan report. And then you can just sit down and say, hey, are there other things you're working with us on we don't have on this list? Are some of these things done? Whatever it happens to be in there. So that is all about reporting here. Any questions on reporting?
Not yet, though I have a feeling I am going to have them in the near future.
Well, what's going to happen is you guys are going to get in there and play with it, and then you're going to have questions, and then you pick up the phone and call me.
Absolutely.
Yep.
Okay, let's go to VMSG Public. The report that you saw is a very, very detailed report. If you're showing that to somebody on the outside or somebody at a high level, they're going to look at that report and say, that's way too much detail. I don't want to have that. What they want to have is something that's kind of graphically oriented and very simple to do. So that's what VMSG Public is all about. So I'm going to go ahead and go back to your organization here. Here we go. I'm going to go down to our groups tab, and I'm going to use the Tobacco 2025 group here. And so this button right here appears on all of the screens at the pyramid here. This is VMSG Public. I'm going to go down and move down a little bit. I'm going to start at tobacco cessation. And in fact, I'm going to go down another level, reduce smoking in high schools. So this is what I want to have a web page of that. So the first thing I want to do is I want to see the whole goal, which includes all the activities and or objectives. So I'm going to click on this button here. It's going to give me the option to be able to select, in this case, objectives or activities. If I were at the service initiative level, I would have a third view in here of goals. So I could look at the traffic lights for the goals. I'm going to select activities here and hit the button here, and it's going to generate what we call an indicator row. So here's the indicator row, which is our goal of reduce smoking in high schools, as you can see there. And you got rollovers. It says we have 3 gold, 2 green, and 1 yellow, and we are currently 6 days behind schedule. So that's the first row. I'm going to go ahead and say, yeah, I like that. I'll keep it. So I've saved that. So that's the first indicator row. Now I'm going to go down to our objective level, and I'm going to look at reduce smoking at Wayne High School. So let's go ahead and generate now, because the only level that you could select would be activities, it doesn't give you that choice. So in this case, it says we have 2 gold and 1 green, and we're 7 days behind schedule for Wayne High School. So we'll save that. Now, in a second, I'm going to show you how we generate a different type of a chart for when you get to the objective and activity level. But for now, I'm going to go up and generate one for reduce smoking at Desert Vista High School. Same thing. I'll look at that. And here's our indicator row, 1, 1, and 1, 5 days behind schedule. Go ahead and save that. So these are the 3 rows. Now I'm going to go back to my objectives, Wayne High School, and I put a little bit of data in here. So if I want to look at that micro level chart in a miniature version on this chart, I can either go to the chart button here, and then this is the VMSG Public button right here, or I could go to the history thing, same exact thing. No, I'm sorry, I can't do it from there. I don't have that. This is the export button and not the VMSG Public. So my fault. So if I wanted to be able to generate the chart for that, I'll click on my chart button, and I'm going to go ahead and generate a VMSG Public chart. So this is that exact same chart, and the rollovers show you how far along you are, 0.15, 25%. So I'll go ahead and save that. Now, this is down at the bottom, and I really want to move it up to be under, because this is still Wayne High School. So what I'm going to do, this is my sort order over here. So my Wayne High School is 20 and Desert Vista is 30. So I'm going to make this 25. That's all I got to do is just change, just a sort order is all. I'll go ahead and save that, and it should move up a row. Now, to generate that web page, so these are the 4 indicator rows I want on my web page. To generate the web page, you just click on this button to export it. And sure enough, there's your web page. So you're saying, yeah, this is what I want. I have reduced smoking in high schools, got all my rollovers, all my charts. Down here, I've got reduced smoking Wayne High School. I've got the this chart, and then I've got the actual detail chart below it. And I could do the same thing if I had data in the Desert Vista High School as well. So I could have this chart over there. So it's showing you the data over time. So I'm going to say, yeah, this is the web page I want. I'm going to save it. And there it is. So I'm going to give it a description. We're just going to call this training web page. And we'll save that. Okay, so this is the actual web page. This is the link. You may notice that it's actually up on our server, so it's available 24/7. So just grab this link, hit Control-C to copy it. Go pop open a new browser tab if you want to, and Control-V and enter, and it'll show that chart. So that's your web page. Now, what you want to do with this link, if you throw that link into an email and give it to somebody, when they click on it, it's going to take them to this exact chart. Same thing on our servers. They're going to have access to it. If you give it to your IT folks and say, hey, can you put this up on our public-facing webpage under our tobacco program so people can see how we're doing on reduced smoking in high schools, it's all cool to be able to do that. So you've got that up there. Now, you can also go in the background and update all the data. So once you create this link, next time you go in there to save it, it's going to say, hey, do you want to overwrite this link? Meaning the link stays the same, but the data elements. So say maybe it's a month later and we've done better and you want to be able to show the progress in here. So you can just update the data behind there and not have to change the link on your website or anything like that. Now, everything to the left of this little pie chart is a kind of a miniature web page in itself. So if you guys, most people don't do this, but I'm just saying you can if you want to. If you want to play with HTML, you got to understand HTML code a little bit in here. But you can actually change these. You can put graphics in there. You can put links in there. One of the things we did for one of our folks is the ability to go in and say, okay, we have the reduced smoking in high schools in here. And they wanted to be able to see the report. So you have for more detail, click here. And you have a link, and then it pops open in a new browser tab. It pops open the operational plan report. Remember, it's a web page in itself as well. You can put in different graphics and things like that. Maybe a picture of a cigarette you can put out or something along that line, whatever you want to be able to do. Now, these tags that create the bold and the italics and all that stuff are very simple HTML tags. I'm going to walk you through the 4 of them that we use when we generate this web page. But you can use any HTML tags you want. If you're not familiar with it, you can just type HTML tags in Google and it'll show you 1,000 different websites that'll teach you how to do HTML. But again, it's not something that most people do, but I just want to show you can. So the first one is the font tag. So you always start out with a less than sign and call it open bracket, font. The face is Arial font. Size is 1:7, I believe. Color, navy. You can put pretty much anything in there. It'll find a color. You can put blue and pink and dark blue and whatever. The text is that you're working on is here, and then you're going to do a slash font or a close bracket, if you will, here. So this text will look like this based on what we put into here. If I
Yeah,
just
it's been a long time since I've done any HTML coding. If I remember correctly, you can hex code colors
yes, you absolutely can
with HTML. Yeah.
Yeah. So what you'd have here is a pound sign and 6 digits. Same thing with the colors and the size. Yeah. So you don't forget everything, do you, Aaron?
Yeah, I haven't, not since my MySpace days have I messed with HTML, but
Well, it's kind of fun in here because, like I said, that whole little left side is a mini web page. You can do all kinds of cool stuff with it, if you want to have fun with it. So,
thank you.
You'll certainly remember this. Put a bracket B and a bracket /B around it. You get bold text. Italics, same way. Bracket I, bracket /I. It's italics. You can mix these two together. So you put the bracket I in front of the bracket B, bracket /I after the bracket /B, and you have bold italics. And then the other one we use is line break. So you put these side by side, bracket BR. There's no close tag on it. And you'll just have a line feed for every one of them in here. So I can put as many vertical lines in there as you want to have. The other thing you can do, and I'll show you where you get to that. Go back to the dashboard here, go to the main menu, scroll on down. So this is how you manage those indicator rows. And this is how you manage the actual web pages. So if you want to remove them or edit them or whatever. So manage indicator rows. Here they are, same ones we had. If I wanted to go in, I can take all this HTML out, and there's a default in there. So let's say I just want to see the reduce smoking in high schools. So I'm going to go in and take out everything, before reduce smoking in high schools and everything after that. And then I'm going to save it. And this is my preview button here. I'm going to look at that. And it's all it does is just take out all the, it puts a default, I think it's a 12-point font and Arial font, that sort of thing. So you can do that if you want to reduce the amount of text, because you do realize that at some point in time, like down here at the bottom, you get, some people might be confused. Tobacco programs, tobacco cessation, reduce smoking in high schools, reduce smoking in Wayne High School. So you could just take it down to reduce smoking in Wayne High School if you wanted to. So that is everything I had to go over today. And look,
That's wonderful. Thank you so much, Fred. I really appreciate this.
I got you done before your deadline here.
Oh, wonderful.
Okay, now the cool thing to do is to get in there and play with it. So as you get your plans in there, or you got the training plans in there, that kind of stuff, go play with it, generate reports, see what you can do with them. And then if something doesn't look right, pick up the phone, call me or email me or whatever, and we can dig into it.
Thank you so much, Fred.
Okay, we do have another training to schedule. I don't know if we've scheduled the.
I think we've scheduled it. I think we're meeting on Tuesday the 1st.
Okay, perfect.
At 2:30, if I remember correctly.
Well, I will believe you.
That's right. I just checked the calendar.
Oh, thank you. Okay, so that's only about a 30-minute training, but it's all about managing the categories and categorizing stuff, and then those other 3 reports we talked about, how to extract data based on what grant is being used, or what FAB standard is this tied to, or which of our strategic initiatives is it tied to. It's all kinds of cool stuff you can do with it. So I think you'll be very interested in seeing that.
Excellent. Hey, thank you so much. Have a great weekend.
You guys have a great weekend too. Hope it doesn't rain too bad for you.
Yeah, us too. Take care.
Hope it cools down. Thank you.
Yeah.
Bye-bye.
It is. I'm happy about it.
Yeah, I bet. Yeah, 100 is it's far too early for the 100.
Yeah, I agree 100%.
Yeah. Take care, Fred.
Talk to you guys.